Hi everyone, welcome back to Raaonline. So this is Dr. Ashok, clinical microbiologist. So today we are going to study about the Bordetella pertussis. So in the previous session we have learnt about the theoretical aspect of this particular Bordetella pertussis or whooping cough. So now we will be seeing about the case oriented multiple choice question. So I will show you a case and let us see the multiple option and let us select which is the best for that particular case scenario. So let us see about multiple choice question number 1. So here we are provided with a case scenario where a 3-year-old boy was brought to the pediatric outpatient department with the complaint of severe cough. After prolonged coughing, the boy vomits out and no proper vaccination history was present, and what could be the appropriate diagnosis among the options provided? So the options are diphtheria, tetanus, Bordetella pertussis and salmonella. So we all know diphtheria, there is going to be fever and there is going to be the formation of pseudomembrane. So that is about the diphtheria. In case of tetanus, there is going to be the presence of the particular CNS manifestation characterized by something like opisthotonus. And in case of salmonella, there is going to be fever associated with the rashes. So that is going to be the clinical feature of salmonella. So whenever we see about Bordetella pertussis, there is going to be the 3 stages. So first is going to be the catarrhal stage where the patient is going to experience fever, coughing and flu-like illness, and after that the patient is going to experience something called paroxysmal stage where the patient is going to have coughing and there is going to be post-stressive vomiting, and after the particular paroxysmal stage the patient is going to go into the stage of convalescent where there is going to be a reduction in the severity of the illness and there is going to be arisal of the complication. So that is going to be the various manifestation of Bordetella pertussis. So here it is going to be the Bordetella pertussis where the particular baby is in the stage of paroxysmal stage. Stage or phase. So here what is going to happen is that there is going to be severe cough and post-stressive vomiting. So that's about the multiple choice question number 1.